can have your insurance verification form. You can have your history forms. Anything right now that you're collecting data on can be digitized and can be done so in very short order. And you could be up and running with digital forms in a matter of a couple days. And it's not cost prohibitive. Like I said, it's probably a couple $100. Adjust your process internally at the practice side, but incrementally improve patient experience as a result.
You know, if you are a practice that still does not offer online scheduling, by creating one of these forms, you could do a schedule an appointment form. Again, totally HIPAA compliant. The bare minimum amount of information you need, because you want to make it easy for the patient, but still they could fill out this form. Same thing happens. Team gets notified. Even if you have to call to confirm the appointment, whatever it is, at least then you are now offering some type of quote unquote online scheduling that you weren't doing before this. And that alone should pay for the forms 10 times over.
Hey there, welcome to the Dr. Marketing Tips Show. I am Jennifer.
And I'm Corey.
And today we're going to talk about simplifying patient intake, how HIPAA compliant forms can reduce staff workload and improve the patient experience.
Yeah, so this is something that we've been having a lot of discussions around with both internally and with clients. You know, just the idea that there's this growing need for efficiency in medical practices, partly because maybe there's less people to do things, and maybe the workload is just different than it used to be. The workforce is also different than it used to be. So one of the things that we're always focused on is, especially lately, is really partnering with HR and operations to make things as easy as possible. And I think one of the key ways to do this is introduce these HIPAA compliant forms to make it a little bit easier for staff, but also easier for patients to kind of get things done.
Well, yeah, because I feel like, okay, we all know this, like you go in, right, and you have like your health questionnaire, and you feel like you fill out the same dang form every single time. Like, how many days a week do you drink? Do you smoke? Do you have any gastrointestinal issues? Have you ever had cancer? Like, it's always the same forms. And even when like the practice will send a patient the form in advance, there's still so many practices who are using as their intake physical forms. So they wait till the patient gets there, which is annoying. Or they're sending them like a PDF, having the patient fill out the form. And
which
then
never works right, by the way.
No, and then they're giving it to someone who has to then intake that form into whatever, like they have to transcribe the form into whatever. And it's just a giant cluster. And so if you could improve the patient experience and reduce workload by using HIPAA compliant forms, why would you not do it?
Right. And I think that, one of the things to keep in mind is there's, like anything, there's a little bit of nuance to doing this. So, there's some form solutions where it'll integrate right into the EHR. So, your EHR probably has some type of form solution that you most likely have to pay for. And then you can fill out the forms, then it goes right into their chart, or it creates a new one, which is great. There's other less expensive ways where you can still collect the HIPAA compliant data and make it easier on your team and on the patients. And they just fill out a form, and then that comes across, you get notified, you go in, and then somebody, still has to copy and paste or download the data or whatever. But it's so much faster than trying to transcribe something where somebody like me has chicken scratch handwriting and you can't see if that's a 9 or an A, and then it just creates all kinds of issues.
Yeah, and I think that then there's the ultimate, which is do a form and it looks beautiful. It's sent to my patient in advance, and either I download the form off a secure website, or in a perfect world, it goes into my EHR.
Right. It can be fed into it, and at least the bulk of the fields can match and sort of set that up. Yeah.
And I do think in the future, in the not so distant future, it could just be a voice form.
Sure.
Where you're having a conversation and it fills it out for you and it's done.
I was looking at a technology solution yesterday, actually, where the not so distant future was yesterday.
Tomorrow or yesterday.
And
Okay.
yeah. And so basically like the AI could have the phone call and say like, how can I help you? Or you would call in, I guess, and then say, how can I help you? I would say, I would like to book an appointment. It would say, great, I can help you with that. Let's get started. And then as I'm giving it the answers, it's creating essentially my chart as a new patient, totally done with AI. Because it's integrated with the EHR, not only did it create my chart, but at the end it'll say, well, when would you like to be seen? I've got availability Tuesday, Wednesday, Thursday at these times. And then I can book and have everything pretty much ready to go. So I was looking at that yesterday. It was mind blowing. It's really cool.
Okay, so we start with, improving the intake process from printed forms to now AI is able to complete the intake process and all the form fills and get the chart set up. I mean, what a difference of literally like what some people are doing to what could be happening yesterday.
Yeah. And I mean, they both do the same thing, right? I mean, they both reduce paperwork errors. They reduce manual entry, makes the team happier, makes the patients happier because they don't have to do this stuff. You can do it for scheduling appointments, consent forms,
insurance verification, payment forms, you name it.
Right. And it just really streamlines this whole check-in, check-out process, makes for faster service. Again, that makes everybody happier. There's just so many different things that you can do that work really well and, relatively easy to implement. Even if you're saying like, okay, all this talk about EHR and all this AI nonsense, that's crazy. I just don't want to deal with having to buy so much printer paper. Then you can just simply start by having a HIPAA compliant solution where you set up your forms, someone fills it out, and you get an email that says, hey, you got a new form. And then your staff can go in and grab that and copy and paste. And even that can be a noticeable day-to-day improvement in the office because you're not having to deal with so much paper and trying to decipher what people are writing on these forms.
Well, you can because, okay, so let's just say like we use the form platform that we use. So it's 100% HIPAA compliant. It's really not cost prohibitive. It's a couple $100 a month to have these forms available. You got someone on your side, on the practice side, who is continually logged in because you're dealing with patients all day long, every day. And before a patient's appointment, they get a text message or an email sent to them. Go ahead and fill out this paperwork. This becomes part of your automation for patient intake. The patient gets it. The forms will resize based on the device that you're on. So the patient can do it in their car, on their phone, whatever, on their computer, whatever works for them. Patient fills out the form. It's a seamless experience. It looks like your brand. It feels like your brand. It has a big HIPAA seal and a secure lock on it. And then the person on the practice side is logged in and they see that a new patient has filled out the information. Let's say you don't have interoperability and you can't connect to your EHR and that's just too much of a lift. Well, then you download the spreadsheet in your secure environment and upload it to your practice management system. And all of a sudden you have all the information. You don't have to type. You don't have to, it's super simple for the patient. It's the only interaction that you're having is having to look at the, download whatever it is that you're downloading, if you can't tie it into your EHR. And that's it. It's that simple. And you have good info provided by the patient, not provided by the patient writing it down and then somebody deciphering it and uploading it.
Yeah, and then ideally that, because I think we've all probably been to an office where you walk in and the first person that you talk to, they can barely look up from their screen because they're maybe trying to decipher some notes or to move something forward. And again, I think this ultimately just kind of comes back to you're improving the patient experience. You're making it easier for them. You're allowing your team to focus on more patient care because there's less time spent, again, it sounds silly, but trying to just decipher these things. And so that can have a ripple effect that improves your reputation. With an improved reputation, you have now higher scores on Google, let's say, for an example. That leads to more revenue. It's a win-win all the way around.
Well, and you can have, there's so many different ones that we can use. You can have your health information form. You can have your insurance verification form. You can have your history forms. You know, anything right now that you're collecting data on can be digitized and can be done so in very short order. And you could be up and running with digital forms in a matter of a couple days. And it's not cost prohibitive. Like I said, it's probably a couple $100. Adjust your process internally at the practice side, but incrementally improve patient experience as a result.
Well, and also, if you are a practice that still does not offer online scheduling, by creating one of these forms, you could do a schedule an appointment form. Again, totally HIPAA compliant. Get the bare minimum amount of information you need because you want to make it easy for the patient. But still, they could fill out this form. Same thing happens. Team gets notified. Even if you have to call to confirm the appointment, whatever it is, at least then you are now offering some type of quote unquote online scheduling that you weren't doing before this. And that alone should pay for the forms 10 times over.
Yeah. And I think it would be helpful. Let's share. I think you've got a case study. We had a practice that we were working with who was not having the type of return on investment on the forms that they were running. They were having drop off where people were going through to fill out forms. And then when it came time to actually schedule and put butts in seats, they were unable to do so. And it really involves some reverse engineering on your part and your team's part to figure out what was going on with their forms, that it was becoming a hindrance instead of, an opportunity to improve intake.
Yeah. Recently, actually, that happened. And so essentially what was happening is you could fill out the forms online, but the problem was the way that they had the forms set up, what it would be, I would click the button that says book an appointment and it would open in a new tab. And the new tab had a completely different URL than their website. So it looked a little sketchy, especially if you're a little bit older and you're not as technologically savvy and you're not familiar with the way that these things kind of work. You would say, well, I don't know if I can trust this. And on top of that, when you got to the form, they asked every piece of new information data that they would need to intake you. So it took 15 minutes or so before you could even schedule this appointment. And the way that it was phrased before we started working with them, it basically said, fill all this out, and then we'll reach back out to you to schedule a 15-minute consultation before we can book your appointment. And I was like, whoa, this is so much work. So I have to fill this whole thing out, which I don't even know if I trust. Then you're going to call me, which I don't want a phone call. Then I can maybe schedule an appointment. That's crazy. So we worked to streamline this entire process and have the form housed within the website, but still HIPAA compliant. It's just in a container on the page. So you realize you're still at the same practice. And then also worked and still working to convince the ops team that you don't need to ask all that information right now, especially if volume is an issue. Let's get the bare minimum and kind of get them through the process here. Let's get them in the door. And then change the language a little bit and basically say that 15-minute consultation that you're having, one, let's table if we even need to have that, but that's the appointment right there, because you're talking to a provider in that moment. So that's the appointment, and let's focus on that, and then we'll move forward from there. So doing all of those things, once we were able to implement them, they saw like just in the 1 week that they did that, there was like plus 18 or 19 new patients coming in from the previous week. So I would say a success all around doing that. And it looks like that number has been sustaining for the past couple of weeks. So, it's just a matter of kind of looking at it through a different perspective. But, they were doing the right thing by having the fillable form, but all of the bits and pieces around the right thing just needed a little tweaking.
Yeah. And I think that's the beauty of being in a digital environment, is you can tweak the process by moving things around just a bit. You can see what performs through that kind of split test, just like we would in an ad environment. You could split test, the order that things are being delivered and see what's easiest for the patient.
Right.
Or see what performs the best. And so, a couple of years ago, we would talk about like, you have to have online scheduling, or we'd say you have to have at least a request an appointment button on your website. Whether you're doing it or not, you need to at least have something that lets people do it. Then it became, you need to be doing online scheduling. Like, there's so much data to support online scheduling. You have to be doing it. But now we need to take it a step further, and we need to what's that process? What's that experience like once somebody schedules and they've been confirmed? to the time that they see their doctor. And there's a real opportunity for very low money and low effort to digitize that process, whatever it looks like for you, to digitize that process to incrementally improve the patient experience, which ultimately leads to better reputation scores, better patient outcomes, you name it.
Yeah, and I would say, quick win to do that, just to kind of dip your toe in the water, if you're interested in it, would be sign up with one of these HIPAA compliant form partners. Some of them have 30-day trials, or even if you got to pay for it. If you got to pay for it, it's like
how about $100? Like
yeah, let's call it $150 a month, whatever, and they're all different prices, but around that price range. Do it. Just do it for a month, and then see what happens, because I think what you'll find is your staff's going to be happier. Once they kind of get used to it, and patients are going to be happier too, because everything is going to seem a little bit easier, a little bit faster. You can also
more modern.
More modern, right? And then depending on the form solution too, some of them have single sign-on, they have SSO. So in other words, like the really advanced ones, when I go to fill out this form, it's going to know who I am first. And if I'm signed in and still in a HIPAA compliant environment, it's just going to it's going to pre-populate the information for me, which is great. So as a user, I can go to this form and it's going to give me first name, last name, email, phone, all that just pops in there. Well, I don't even have to fill anything out. This is great. So
just like buying online, you're just filling out a form.
Right. Yeah. Right. You're just taking the Amazon model and making it as frictionless as possible. That's that buy it now button. Let's go.
Yeah, I think that's great. And I think, like, shameless plug, look, if this seems daunting, just call us. We do this every day, all day long, setting these things up, basically have it templatized. Like Corey just said, like for $150 a month, you're probably, you'll have all your stuff, your forms are digitized. Then you just got to build them out and you're done. There's no reason to overthink it. So take that for what you will, but let's improve the patient experience. We're all in this together. And with that, I'm Jennifer.
I'm Corey.
We'll see you next time on the Dr. Marketing Tips Show. Thanks bunch.
Bye, guys.
If you want more like this, hit like and subscribe so you'll always be alerted to new episodes when they come out. And if you want information about us, visit us over at insightmg.com. That's insightmg.com. We'll see you on the next episode.